Good morning, good afternoon, good evening everyone. Welcome to this update of the Taping Bowel and Bladder Dysfunction and Menstrual Pain course. Thanking the colleague who had followed the course for the positive feedback and for bringing the following study, which led me down the path of checking out Coccydynia and its relationship to the pelvic floor, to my attention. I was made aware of this systematic review of randomized controlled trials on the topic of pelvic floor dysfunction by a colleague who had given feedback after having followed this course. When I read this paper by Mohammadi, I found that 5 of the 6 referenced papers had already been discussed and included in the Embodia course. It was the 6th, the Mossad study, that sparked my interest. It was about the management of Coccydynia. Now, we have seen that tape applications for bowel, bladder and sexual organs are often in the same body area. And when I looked at this study, I found that the tapes applied for Coccydynia were applied in very near to the same body area. And then our tailbone is an area that you would normally not consider using tape on. So why am I adding it? Roel Wilbers, a colleague, recently published Coccydynia, a broader perspective on current insights into etiology, biomechanics and treatment options, research into the role of segmental hypermobility and arthrogenic mobilization in Coccydynia, a narrative literature review and a clinical observational study in Dutch. He tells us that, in most patients with Coccydynia, changes in tone are found in the surrounding muscles, and this applies primarily to the pelvic floor muscles. Hence the connection. Mossad and his colleagues studied 42 participants who had been randomly assigned to a conventional therapy group, a group receiving conventional therapy and kinesiotaping, and a group receiving conventional therapy and pelvic floor exercises. Apparently the pressure of the colonoscope can irritate or bruise the coccyx. Painful spasms and prolonged positioning can also agitate in this patient group. They found that the CT-KT with kinesiotape is more effective than the CT with pelvic floor exercises in reducing pain associated with Coccydynia post-colonoscopy. But there is no difference in their effects on functional disability. So, conventional therapy and kinesiotaping is therefore recommended as an alternative treatment option for post-colonoscopy Coccydynia. The authors referenced another study conducted by Abdul Al in 2020 using elastic tape for Coccydynia. In this study, 60 patients with obesity-induced Coccydynia were divided into 2 groups. The authors looked at the effects of kinesiotaping and exercise programs on patients with obesity-induced Coccydynia and found that the group who had had the fan-shaped kinesiotaping applied had statistically significant better outcomes for pain, the modified Schober test, and the Oswestry Disability Index. As I understand it, the placebo or sham tape was placed on the skin on top of the sacrum. It was not applied on the skin covering and near the coccyx. The technique and application described by Dr. Lily Abate is the only other application I have found discussing the use of rigid tape in this case to correct the alignment of the coccyx. I would suggest certainly trying this same application, but then with elastic tape first, as I'm not so sure that we can really correct the coccyx to another position as many claim. I have put all the reference articles here, and Freddie and I would like to thank you for your interest. Freddie is my therapy doll, and in this case he helped me show you the various tapes in an area that most people would not be happy to share pictures of with you. So I'm glad that he could help me.